Right, okay, hopefully that sorted it out. Great, okay, not quite sure what happened there. For some reason my microphone wasn't on. I thought I'd popped it on earlier. Brilliant, okay, so everybody can hear me, this is great. Okay, so I introduced myself a moment ago, so I'll do it again for those who didn't hear because the microphone was off. So I'm Nina Bailey and I'm going to be talking to you today about immune dysfunction and inflammatory processes in ADHD. And I'll go over some of the sort of nutrition protocols that we kind of suggest as add-on treatments for the sort of management of ADHD symptoms. As always, the webinar will be available to you afterwards, and if there's any information that you need about anything that I talk about, then feel free to email me. My email address will be at the end of the webinar, and obviously a lot of you have sort of contacted me before anyway. So I'll crack on. We should be here for about an hour, and there'll be some time for some questions afterwards if you'd like to ask me anything. Okay, so right, okay, so ADHD diagnosis is on the increase, and we know this. So sort of recent prevalence estimates are anything between 8, 10, 11%. So we know it's kind of on the rise. Early intervention, if not prevention, is key for successful management of ADHD. The burden associated with childhood and adolescent ADHD is not really kind of just sort of affecting the children themselves, but it's the impact that it can have on quality of life for sort of parents, carers, families, teachers, and so on. There's obviously the sort of the cost of sort of treatment, so there's economic costs, and then, you know, children are quite often at an increased risk for developing long-term sort of academic underachievement if the condition isn't managed. As children grow older and sort of go into adulthood, we see increased rates of sort of conduct disorders, violence. We may see an increased risk of things like alcohol dependence, possibly drug use, an increased risk of antisocial behaviour, criminality as well. There are a lot of individuals who are sort of in prison who have sort of a diagnosis of ADHD. So the issue is certainly there. When it comes to sort of diagnosing, this is quite sort of difficult as well, because there's so many different sort of symptoms, and getting diagnosis correct is really important. So I mean, we're faced today with sort of behavioural problems on their own, but the sort of diagnosis of ADHD sort of really comes into it. So there's different areas. So there's your sort of hyperactivity, inattentiveness, and impulsivity. And the sort of criteria really sort of depends on a minimum of 6 symptoms of inattention, or at least a minimum of 6 symptoms of hyperactivity and impulsivity. They have to persist for at least 6 months to a degree that is sort of maladaptive and inconsistent, with developmental levels. And so we can sort of divide it into 3 subtypes. So we can have predominantly inattentive, predominantly hyperactive, impulsive, or a combination of the 2. Symptoms have to appear before the age of 7, and they also have to be in school, in the school environment as well as home. So there's been a lot of focus on sort of the causes or the factors that are known to influence ADHD risk. And there's been a lot of talk or focus on areas such as exposure to toxins, environmental pollutants, virus exposure, things like smoking, alcohol during pregnancy are all known to sort of play a role. But there are other stressors that I'm going to be focusing on as well today, and that's things like, or going to be including things like maternal or fetal distress, birth interventions, preterm birth, poor diet, sort of Western style diet, if you like. And a lot of focus is also on a lack of omega-3 or an imbalance of the ratio of omega-3 to 6. And all of these factors are known to sort of, or thought to cause a glitch in brain development that can predispose individuals to sort of developmental conditions, including ADHD. We also know that looking at epidemiological studies and evidence from animal studies that the mother's diet and her metabolic condition are also important when it comes to programming the sort of neural circuitry that regulates behavior that then can go on to sort of persistently impact on the offspring behavior in later life. Various sort of potential mechanisms by which maternal diet and metabolic profiles can influence the perinatal environment include things like placental dysfunction, but also an increase in factors such as circulating pro-inflammatory cytokines. We then sort of address things like nutrients such as excess amount of glucose and particular fatty acids, so things like saturated fat, there is a link. And then there's the sort of role of sort of circulating hormones as well, such as insulin and leptin. One of the sort of major factors that we're sort of looking at the moment are related to maternal obesity and sort of high fat, high sugar diets that are known to increase the risk of developing a series of mental health and behavioral disorders, not only just relating to ADHD and things like autism, but also sort of anxiety, depression, and a sort of myriad of mental health disorders. And the increased risks appears to be due to changes in the sort of development of the neural pathways that regulate behavior, so sort of neurotransmitter pathways, serotonin, dopamine, and so on. And so this is, I've taken this study, it's a 2011 study, and it was sort of quoting that in 2008, around 64%, so this is in the US, I add, but I think in the UK we're kind of catching up, over 64% of women of childbearing age were obese or overweight. And this is due to diets that are in excess of calories and fat. And we know that children from obese mothers are at a much higher risk of developing obesity and metabolic disorders themselves, and also sort of myriad, like I'm saying, this sort of mental health disorders. So the fetus is literally sort of swimming in this sort of pro-inflammatory environment that is triggering it to sort of develop a host of sort of mental and physical conditions later in life. So we also know that diet quality reflects inflammatory markers. So if we have a good quality diet, so one that is characterized by high intakes of vegetables and fruit, whole grains, fish, legumes, and so on, these sort of diets are associated with low levels of plasma concentrations of inflammatory markers such as CRP, interleukins, homocysteine, cell adhesion molecules, and so on. But it's this sort of unhealthy Western diet. High-fat diet generally, sorry, Sheila Shepherd's just sort of talking there. I'll talk a little bit more about that in a minute, Sheila. But some of the studies that sort of look at high-fat diets are really looking at sort of particular saturated fat. So you can have a high-fat diet, but depending on the quality of the fat that you're consuming, so it's generally sort of saturated fat, or sort of animal products and animals that have been raised on sort of grains rather than sort of natural grass themselves. So, for example, if you look at the different types of fatty acids between grass-fed and grain-fed, levels of things like stearic acid, palmitic acid are much lower in grass-fed, and these are the particular types of fatty acids that are known to sort of trigger some of the sort of inflammatory pathways that are involved. So yes, so unhealthy sort of Western patterns, sort of high processed meats, highly refined carbohydrates, and other processed foods are known to increase inflammatory markers. But something that I'll be focusing on for a little bit here is the way that diet quality affects gut flora composition, because this is itself known to play a really important role in sort of fetal programming itself. So as we all know, our gut flora is there for a very good reason. It helps to maintain cell membrane integrity. It's directly involved in sort of immune status. It also plays a role in sort of digestion, producing sort of byproducts such as butyrate, which help to sort of fuel the cells of the gut lining. So it produces a sort of range of beneficial metabolites. That's if your gut flora is nice and healthy. Obviously, if you have the wrong kind of gut flora in there, then you're going to be producing a myriad of sort of metabolites that are not going to be quite so beneficial, and that can themselves sort of induce an inflammatory response. And the mother's, not just her gut flora, but sort of oral hygiene, placenta, vagina, cervix, the flora that exists within all of these kind of areas are known to influence and regulate the timing of birth. So it's really important to be looking at the type of sort of bacteria that are sort of hosting in these areas. This is really as well to sort of highlight some of the sort of effects that we see from different sort of bacteria. Something called toll-like 4 receptors are present within the gut, the epithelial cells, so these toll-like 4 receptors here. And if our gut membrane integrity is compromised, and we have a sort of myriad of harmful bacteria, they can go through and stimulate these toll-like 4 receptors, which then go on to trigger the sort of main transcription factor, nuclear factor kappa B, which then controls an array of inflammatory cytokine genes. So basically, if you allow the bad bacteria through the sort of mucus into the gut epithelial cells, we then kind of get this sort of induced inflammatory response. And these toll-like 4 receptors are stimulated by lipopolysaccharides, and these lipopolysaccharides are found within the cell membranes of gram-negative bacteria. So gram-negative bacteria tend to be the ones that aren't very beneficial for you. But we know that toll-like 4 receptors are also stimulated by sort of saturated fats, as we're saying, palmitic acid, stearic acid as well. So depending on what we're eating and depending on the kind of bacteria that's lining our floras, can stimulate inflammatory pathways. So here we have our toll-like 4 receptors, we've got our polysaccharides, we've got dietary factors that can all activate nuclear factor kappa B, but then we've also got other inflammatory stimulus as well. So we've got injury, we've got infection, but we've got psychological stress. And for anybody who's sort of joined us in any of our other webinars when we're talking about the role of chronic stress in inflammatory pathways, you'll probably be relatively sort of familiar with what I'm talking about. So it's a combination of diet and environment and sort of stresses that all activate these various sort of inflammatory processes within the body. We have nuclear factor kappa B, which stimulates or activates the production of various enzymes that are involved in the production of prostaglandins, leukotrienes, thromboxanes, that then go on to increase inflammation. We get our pro-inflammatory cytokines, and then we get our sort of acute phase proteins, so CRP, for example, one of the sort of pro-inflammatory biomarkers, really, of giving us an indication that there's an inflammatory response going on in the body. And I've included this slide as well, just as a little example, because there's not a huge amount of sort of information out there on actual pro-inflammatory markers within people with ADHD, but I did come across this one. ICAMs, so these are intracellular adhesion molecules that play a role in inflammatory processes. So high levels, for example, will encourage the infiltration of leukocytes, which stimulate the inflammatory response. So the intracellular adhesion molecules are located within the cell membranes, and they kind of act like a glue to help the leukotrienes stick, which then allows them to sort of cross through the path, a process called dysbiosis. And high levels of intracellular adhesion molecules are found in people with vascular disease, autoimmune diseases, and several studies have correlated serum levels of intracellular adhesion molecules with the severity of disease as well. And like I said, I came across this study that showed higher levels of ICAM in individuals with ADHD compared to controls, and interestingly, they actually showed that these levels were decreased in ADHD patients who were treated with methylphenidate. Okay, so going back to our gut flora, certainly we know that human reproduction actually requires microbial homeostasis, certainly in the female reproductive tract. And quite often we find that women who struggle to conceive, it's quite often related to different sort of types of dysbiosis within the vagina itself and within the cervix. We also know that the colonization of the newborn with beneficial microbes is also really important as well. And it's this maternal transfer during pregnancy and lactation and during the birthing process itself that actually can influence the sort of almost to the sort of neurodevelopmental processes of the fetus itself or the newborn. We know that children who are born by cesarean section, for example, have a completely different gut flora from those who are born sort of naturally, and the latter involving exposure to the mother's bacteria, whereas delivery by cesarean section generally involves exposure to the skin flora. Children's gut bacteria start to sort of stabilize at about the age of 1, and then they become very adult-like by the time they reach 3. So it's kind of a window of manipulation. So the mother's gut flora and vaginal flora can actually influence the sort of gestational age of the baby itself. And we know that preterm birth can be linked to dysbiosis itself. We know that babies who are born prematurely are at a higher risk of illness, disability, and death. In 2012, the stats tend to indicate that about 7% of live births are preterm, although about 92% of them are actually sort of after 28 weeks. So, and also that about 85% of all babies born prematurely will have a very low birth weight, which kind of really makes sense. Preterm infants are at increased risk of a wide range of developmental disorders, including sensory, motor, cognitive, and other brain disorders as well. And the risk is highest in infants that are born before the age of 28 weeks. Not awfully sure, other than sort of some of the factors that I've talked about, what causes preterm births, but about 25%, as I said, may be related to sort of bacterial infections that come somewhere from the mother's own body. And this is quite an interesting case control study that I came across. It involved 49 women, and they were analysed for microbiomes from vagina, the gut, salivary, and tooth and gum. And then they were followed throughout pregnancy and for 1 year after birth as well. What was quite interesting was that it was only really the sort of vaginal gut, not the gut flora, the vaginal flora that showed differences during and after pregnancy. So all the other sort of areas stayed relatively similar. 15 women delivered preterm, and there were significant differences between the flora patterns between mothers of preterm birth and mothers who carried babies to full term. So we also know that maternal infection is a frequent initiator of preterm labour. So again, so high levels of infection, inflammatory response, any fetus that is exposed to a strong pro-inflammatory challenge will be at a higher risk of preterm delivery, and also in some cases some element of sort of brain damage as well. So pro-inflammatory cytokines such as TNF-alpha can affect the developing brain, crossing the blood-brain barrier. And we know that pro-inflammatory cytokine response are also involved in the pathogenesis of preterm brain white matter damage as well. And we can actually sort of, I was going to go on to the next one. No, sorry, I'm just missing a slide. I'll talk about that one in a moment. Okay, so when it comes to preterm birth and the risk of ADHD, this is a study from 2011 showing that preterm and early term birth increases the risk of ADHD by degree of immaturity. So, for example, babies who are born extremely early, so anywhere between sort of 23 and 28 weeks, have about the double risk of developing ADHD compared to those who are carried to full term. It's quite a good sort of strong indicator that preterm birth or linking preterm birth and ADHD. So I hope you can see this slide. Some of the sort of factors here are very small. So it's just really to sort of highlight and emphasize the sort of transition of the development of the gastrointestinal sort of flora. Anything from sort of during pregnancy itself, whether the baby to full term, whether she has a cesarean, whether she has a vaginal birth, whether she breastfeeds or bottle feeds, and then we have environmental factors. It's quite likely as well that preterm babies are often sort of have a high exposure to antibiotics in the first sort of months of life. And that itself can disrupt sort of normal gut flora as well, and just the sort of process of being hospitalized. And then there's obviously a sort of genetic role there as well. So it's all quite interesting, this sort of link between sort of gut flora, preterm birth, ADHD. And whilst the sort of subject of probiotics gets a lot of battering, and sort of, you know, we're talking about sort of health claims and what probiotics can and can't do, they are widely used in hospital settings. And this is a rather nice study again that I came across looking at probiotic intervention and ADHD outcomes. And so this study looked at 75 infants who were randomized to receive lactobacillus rhamnosus or a placebo during the first 6 months of their life. And then they were followed. So these are just normal delivered children. They were followed up for about 13 years. They looked at their gut flora at the age of 3 weeks, 3, 6, 12, 18, 24 months. And then there was a rather large gap going through into 13 years. They then looked at the diagnosis of ADHD and Asperger's syndrome, and they found that at the age of 13, ADHD or Asperger's syndrome was diagnosed in 17% of children in the placebo, but none in the probiotic. And they also looked at the number of sort of bifidobacterium species in the feces during the first 6 months of life, and found that they were significantly lower in children who had been later diagnosed with ADHD. So it's quite interesting as well. So it kind of highlights the importance of establishing a healthy gut flora very early in life, and whether probiotic supplementation early in life may actually reduce some of the risks of developing neurodevelopmental issues later in childhood, certainly. And if we look at the sort of prevalence of gut dysbiosis and how that affects leaky gut syndrome in children with ADHD, it's really common to find that the two are linked. The majority of kids with ADHD will show some sort of symptoms that are related to sort of damaged epithelium. So we start seeing issues with things like gluten intolerance, lactose intolerance, and so on. So this is a really highlight. I haven't really sort of talked about toxicity and vaccinations, but they also sort of play a role, but sort of highlighting the importance of sort of antibiotic use and diet in influencing I'm not supposed to be doing that, influencing gut dysbiosis in children early in life, and how this then predisposes them to sort of toxin translocation through, leading to gut permeability, which then can lead to things like food sensitivities and sort of gluten and casein, inappropriate sort of actions within the body as well, which can then lead to sort of gut inflammation, which then takes us all the way back round to sort of fueling this gut dysbiosis, and then sort of going through the other pathway. Where we have gut inflammation, we then have sort of increased systemic inflammation, which then itself causes a load of sort of different issues in itself. So the importance of gut flora really kind of comes into its own when we think about the relationship that the gut plays with the brain, and this sort of gut communication with the brain is thought to work partly through the sort of vagal nerve, which connects the network of nerves of the gut to the brain. We then see circulating immune cells that are primed or educated from the gut that then travel to the brain. And we also have the metabolites that are produced by the gut bacteria themselves that then can enter the blood and circulate to regions of the brain where they affect behavior. We also sort of, the toxins and the byproducts that are produced from sort of food particles, gluten, casein, and so on, that move through the gut and enter the bloodstream itself. And these can all sort of impact on behavior. And this slide here really sort of highlights the two pathways themselves and some of the sort of factors that we see, the sort of from the gut to the brain and then the brain to the gut. So the generation of neurotransmitters, for example, going through into the induction of epithelial cell release of molecules that stimulate afferent axons, change in tryptophan metabolism, which then has an effect on behavior. And I'll talk about tryptophan metabolism a little bit in a minute as well. So there's all these factors that are sort of cross-talking between the brain and the gut that are known to influence many of the symptoms that are sort of associated with ADHD. And so, as I kind of mentioned already, that a lot of children with ADHD may be influenced by the absorption of many sort of gut-derived bacterial toxins. They have increased gut permeability, and several studies have shown that the integrity of the intestinal lining is compromised in not only just ADHD, but autism, autistic spectrum disorder as well. And in fact, the sort of link between leaky gut is there's a lot more publicized, or there's a lot more publications based on autism rather than ADHD, but the links are still very much there. This increased gut permeability leads to the absorption of many microbial byproducts, as well as partially digested food compounds, and these affect brain cell functions that directly lead to immune responses, which then go on and sort of affect our brain cells. And we know that probiotics can improve gut barrier function, but it's thought that probiotics actually also can have additional benefits by working through sort of mechanisms that influence inflammation and immune regulation as well. So I mean, this is an area that we're really interested in at iGenus, and we are hoping that at some point we'll be able to supply a really good quality probiotic, but we're doing a lot of research at the moment, and there's, as you're probably aware if you know anything about probiotics, that there's a vast array of different probiotics that are available. Different species have different actions, and I've just sort of listed a few here that I know that have lots of scientific backing behind them, that are known to sort of help repair leaky gut syndrome, or to prevent the sort of overgrowth of pathogenic bacteria. And if you look at the link at the bottom there, that will take you to a site that tells you a little bit more. Generally, products such as Optibax tend to be used quite successfully, however. So I'm talking about gut flora and I'm talking about preterm birth. But now I'm going to talk a little bit about the consequences of possibly preterm birth on neurological development. So if we think about the fact that the brain is developing at such a high rate, and that the majority of the brain development actually occurs during the last trimester, we can start to sort of put some links between omega-3 deficiencies and neurodevelopmental issues. So obviously the more preterm you are, the less sort of brain development that you're going to sort of be able to sort of accumulate omega-3s. We know that long-chain fatty acid accumulation in the normal growing fetal brain is around 67, if not a little bit more, in the last trimester, and the total brain volume has a massive sort of spurt. 80% of its maximum volume is achieved within around 1 to 1.5 years, although it does carry on between sort of 2 to 4 years, and then another growth spurt between 6 and 8 years. But it's this sort of window, but in the last trimester, that's really, really important. So children who are born preterm will not be able to accumulate the same kind of levels of fatty acids as those children who make it to full term. And we know that polyunsaturated fatty acid deficiency in newborns does have consequences, and we see this, you know, using sort of animal models, for example, where you can induce an omega-3 fatty acid deficiency. We can start to sort of see areas of the brain that are susceptible particularly to sort of things like dopamine and adrenaline and noradrenaline and all the sort of serotonin things can all be affected. And if you induce puffer deficiency in rodents, we see behavioral changes. So things like increased motor activity, decreased learning abilities, the dysregulation of sort of neurotransmission pathways. A lot of these symptoms can actually be reversed when polyunsaturated fatty acids are reintroduced into the diet. And the emphasis here is sort of on animal models rather than sort of human models. Omega-3s are wonderful fatty acids, so it's not just necessarily about the sort of structural role that they play in the body. It's the consequences. If you don't have omega-3 in your cell membranes, then you're going to have reduced cell membrane integrity, reduced fluidity. You're going to have factors affecting sort of transport, and then sort of inflammatory processes and signaling cascades, and there's a myriad of functions that omega-3s do. And so if we start sort of depleting them from not only our brains but from sort of cell membranes anyway, then we are going to be faced with sort of metabolic consequences, as it were. And so this is a sort of slightly simplified, simple diagram from the one before. if we increase our omega-3 intake, then we alter the composition of our inflammatory cells and our other cells, obviously, but we see alterations in things like lipid rafts, which then alter the sort of pro-inflammatory cell phenotypes. We get signal transduction pathways, so we have the ability to modulate nuclear factor kappa B. We have changes in lipid mediators, so prostaglandins, leukotrienes. So increasing omega-3 is beneficial because it alters our inflammatory cell phenotype and it alters our inflammatory response. So basically, if you increase your omega-3 levels, then you not only sort of increase your cell membrane integrity, but you will also be able to control inflammatory processes and immune function as well. So the whole kind of idea that there was a role of essential fatty acids, or omega-3 fatty acids particularly, in ADHD was actually proposed about 30 odd years ago, where deficiency in long-chain fatty acids was first shown. Since then, there has been accumulating evidence to support this hypothesis, and also that omega-3 fatty acid deficiency plays a major role in the etiology of ADHD and autism. And this is because there is a high male to female ratio between them, so between 3 and 4, but for both disorders. And we know this because females are born with more omega-3, EPA, and DHA than males, and they are better at converting ALA, so our parent omega-3 fatty acid, that should say EPA, not EP, and to DHA, because estrogen enhances the converting enzymes, whereas testosterone inhibits them. So basically, more boys are susceptible to developing ADHD and autism than females, partly because of the role of omega-3 fatty acids. So deficiencies and imbalances in long-chain omega-3s has been implicated for a long time, and lower red blood cell levels of EPA and DHA, and also biomarker of inflammation, the AA to EPA ratio, has also been shown in children with ADHD compared to aged matched controls. And it's not just about the process of accumulation of EPA and DHA during sort of the developmental stages, but there's also thought to be a role of sort of lack of dietary intake, inefficient conversion from parent fatty acids, and enhanced metabolism. So children, if they're, and adults as well, if you're not getting long-chain fatty acids in your diet, then it's very unlikely that the body is able to really kind of support the levels that we really require. We have various biomarkers of fatty acid status, and these include the omega-3 index, which is the amount of EPA and DHA within our blood cell membranes, expressed as a percentage of total fats. And then we have our AA to EPA ratio, which is inflammatory arachidonic acid to sort of anti-inflammatory EPA. And this gives us a nice biomarker of our inflammatory status. Because there has been a link between long-chain omega-3 fatty acids and ADHD and ADHD symptoms, unsurprisingly, there have been an awful lot of studies that have looked at omega-3 interventions. And as, again, if you've sort of come to any of our webinars previously, you will know that fish oil studies, no matter what the sort of subject, whether it's depression or dementia or diabetes or anything, fish oil studies produce conflicting and contradictory findings. And the consequences of that is that we get quite alarming messages sort of spurted out to the general public, and everybody sort of panics and thinks that omega-3s don't do anything. But we have to look at some of the sort of meta-analysis data, and we have to look at sort of study designs to really kind of get an idea of what's going on. This is a meta-analysis that was published in 2011, and for the sort of many trials that have used omega-3 fatty acids as interventions, this sort of pattern has really kind of developed that supports the hypothesis that there is a relationship between the EPA and DHA ratio within fish oils and the successful outcomes, and again, not just for sort of children's neurodevelopmental disorders, but we see it in sort of other areas of mental health as well. I'm not sure whether you can sort of see the graph very clearly, but the outcome is that EPA-rich preparations tend to be associated with clinical efficacy. So we have studies reporting on sort of EPA-DHA combinations, pure EPA, pure DHA, and the kind of outcome really suggests that if you treat neurodevelopmental disorders with a pure DHA oil, it is unlikely that you will see clinical benefits, whereas if you treat with EPA DHA oils, you are more likely to, and as the EPA content of your oil increases, then so does the efficacy. As with all of these kind of fish oil or fish oil isolate studies, we'll get meta-analysis published after meta-analysis, and there was another meta-analysis published a year later, and this was a Cochrane review, and they tend to be quite highly rated, and they kind of showed that there was a sort of contradicted the previous meta-analysis actually, and they showed a non-significant trend for improvement. So they kind of showed that omega-3 supplementation worked, but it wasn't significant. So, but what they found, which was quite interesting, was that the likelihood of improvement actually comes when your fish oil contains GLA. So GLA is omega-6, which kind of makes sense when we consider some of the facts that are related to omega-3 deficiencies in children with ADHD, because quite often those deficiencies can be related to compromised activity of delta-6 desaturase, for example, which is also involved in the production of GLA. So bypassing delta-6 with long chain or longer chain EPA, DHA and GLA often is necessary in these children. So the combination of omega-3 and omega-6 supplementation seems to be more beneficial than just omega-3 on its own, but they quite rightly sort of pointed out some of the sort of issues that are related with fish oil studies. And again, this kind of relates back to other interventions as well. So things like cardiovascular disease, dementia, mental health disorders. Any fish oil study, you're going to have issues that's related to the heterogeneity of the design and other factors that may be able to influence the responses and the results, things like duration of the treatment, measure of the response, type and dose of fatty acids, whether you've got long chain, short chain, whether you've got EPA or DHA or both, or the ratio or the inclusion of GLA. And this is kind of where, you know, the whole kind of idea of personalized nutrition really kind of kicks in, because some of the studies would kind of have us believe that the benefits aren't really there, but if you start personalizing it to the individual needs of the client, then we can significantly improve the outcomes. So we have to look at the factors that influence their personal requirements. And I skipped a slide there. Okay, yes, so this slide really is from a more recent 2014 meta-analysis that was carried out, And you might be able to sort of focus in on this later on when you get the slides, but it really sort of highlights the diversity that exists between different studies and different study designs and the type of fish oils that are used. And really, it's kind of not surprising that sometimes meta-analysis publications kind of come up with these sort of inconsistent findings. And this data is actually taken from that same meta-analysis. And what I quite like about this meta-analysis was that the researchers kind of said, well, so many different fish oils get used, and some are highly concentrated and some are less concentrated. And we always kind of focus on what we consider to be the active ingredients within fish oils. But any fish oil is going to be made up of, we have our omega-3s, which we kind of associate with our fish oils. But we also have, we have a small amount of monounsaturated fat. We have saturated fats. We have other types of sort of omega-3 and omega-6 in there. And so they kind of set about to have a look at what other factors within fish oils or within the intervention oil may be affecting the outcomes. So they looked at a set of studies, and they sent off the oils for analysis. So they got a full fatty acid breakdown of all the oils, and then they managed to sort of weight them against each other. And what they found was that the meta-analysis showed a small but significant decrease in all symptoms, and this is quite important as well. So inattention, hyperactivity, and impulsivity with polyunsaturated fatty acid supplementation. So it implies that yes, fatty acid interventions work. What they actually found, again, was sort of highlighting the sort of benefits of EPA, was that the EPA dose was associated with decrease in symptoms, and interestingly, that DHA dose was associated with an increase in all symptoms. So it kind of, again, sort of highlights the earlier work and the earlier meta-analysis that suggests that it's EPA that is more effective in managing ADHD than sort of DHA or DHA-weighted supplements. What they then went on to show, which was quite interesting as well, was what kind of happened or what impact was made if the oil actually had GLA in it as well. And they found that it's the most significant improvements really came about when there was an association between GLA and EPA within the oil itself. So those oils, or those studies that used oils that had EPA and GLA, were the ones that showed the most sort of successful clinical outcomes. So to sort of summarize, so they're sort of multivariable meta-regression analysis. They found that GLA and the interaction between GLA and EPA was significantly associated with symptom submission, which is good. And that EPA and GLA within the treatment product and the length, actually this is another one as well, length of the treatment regime were key influencers in the outcomes. So the longer the intervention, the better. And again, this is what we quite often see in some of the sort of shorter term studies, is that if it's likely that some of the sort of null or poor outcomes that we see in sort of fish oil interventions are just really because people don't sort of, the intervention period really just isn't long enough. And what's quite nice about this meta-analysis as well is that it supports the study that was published in 2012 using EPA and GLA or the GPA. Okay, right, Andrew, I'll just answer your question in a minute. Right, okay, I'll answer your question in a minute, Andrew, because I'm not quite sure what your question is right now. So I've only got a few slides left, so I will just finish off and then answer any questions that come out. So the Pereira study was published in 2012, and we were very lucky to be able to be invited to provide the oil for this study. So it was 4 children diagnosed with ADHD. They were treatment resistant, and they were given 2 capsules of Agipa daily alongside methylphenidate, which was a bit strange because I'm not quite sure why they carried on with the methylphenidate, but they did. They were then assessed at 3 months and 6 months, and what the study found was that after 6 months, the treatment group showed significant improvements when compared to the control group in various areas, including reduction of aggression, improved educational functioning, improved social relationships, improved cooperation with parents and with teachers as well. So the outcomes were really, really positive. And what was quite interesting as well, and this comes back to the sort of treatment protocol itself, was that some of the symptoms, such as restlessness, aggressiveness, anger control, competent working, academic performance, statistically significant improvements were seen at 6 months. But when it came to things like impulsivity, inattention, and cooperation with the parents and teachers, there were only statistically significant improvements at 6 months, but not at 3 months. Right. Yeah. Okay. So sorry, to summarize this slide, really, impulsivity, cooperation with parents, and inattention, you had to wait for a full 6 months before you actually started seeing the sort of benefits of the intervention at this stage. Whereas the other symptoms, we saw them at 6 months and at 3 months. Okay, so I have a quick kind of overview really of the sort of EPA, DHA sort of like utilization differences, and it's like, why DHA, why EPA, what's kind of going on? What we kind of know is that studies often report no benefits from taking DHA. And I think a lot of that is about the way that DHA is actually retained in cell membranes. If we supplement with EPA and DHA, which is what's being shown in this slide here, both levels will rise in red blood cell membranes. When you stop supplementing at 12 weeks, we see that EPA in the top right here, EPA levels return back to sort of baseline actually within sort of about 8 weeks, whereas DHA levels take a lot longer. DHA tends to sort of cling on, and part of that is because of the location within DHA within cell membrane. So it's found within the sort of inside of the cell membrane, whereas EPA is on the outside. The exposure to EPA of sort of phospholipase enzymes that are required to sort of snip it away from the cell membrane and allow it to get converted into sort of downstream products is really important. Whereas because DHA plays such an important role as a structural fatty acid, its presence within the inside of the cell membrane is really important as well. So it's harder to get rid of, it's harder to actually release from cell membranes as well. Basically the way that we utilize EPA is a lot more rapid. We use it a lot more rapidly than we do with DHA, because EPA and DHA have very different sort of functions within the body. When it comes to the role of EPA in particular, I'm just going to focus on that for a moment, and the sort of impact that it has on sort of brain structure and function. So we know that sort of low omega-3 status and sort of high levels of inflammation, so cytokines, cortisol, that sort of affect brain function, elevate immune inflammatory signaling activity, which has an impact on things like serotonin dysregulation, and that's not just in the brain, it's in the gut as well. Again, HPA axis dysregulation, we get changes in white matter, grey matter pathology, and then we sort of see symptoms. And this not only kind of relates to neurodevelopmental disorders, but any kind of brain condition. So we can sort of relate these metabolic sort of pathways through into things like dementia and sort of general mental health issues. But when we have this sort of high level of inflammation and low omega-3 status, high arachidonic acid, low EPA, what we find is that these symptoms are related with increased HPA axis activity. We get an increase in enzymes such as IDO, TMO, KMO that are involved in sort of shifting tryptophan away from sort of serotonin production, going down the kyuranine pathway. We get an increase in serotonin receptor transporter activity. We get low serotonin and so on. So we get things like decreased neurotrophins, neurogenesis. We start to see shrinking of the sort of hippocampus area. We also get decreased delta-6 desaturase activity, but we get an increase in things like COX-2, phospholipase, prostaglandin. So everything, the sort of spiraling this inflammatory process, which is pretty kind of reversible when we sort of elevate EPA levels. So we get if you supplement with EPA, you reduce your AA to EPA ratio, you increase your omega-3 levels, and then we get a sort of lowering of symptoms. And we're kind of basically reversing everything that we see in the last slide. So beneficial effects. And so the relationship as well between sort of tryptophan metabolism. So tryptophan is really important because it's involved in the production of serotonin, dopamine, and so on. And we see that kids with ADHD, again, they have a high kyuranine to tryptophan as well, so implying that tryptophan metabolism is being shunted away from the sort of normal sort of serotonin dopamine pathway. So when it comes to sort of interventions, obviously, you know, we need to be looking at things like sort of food groups, restoring healthy sort of dietary practices, so reducing sugar, reducing sort of poor quality foods, increasing the protein quality, fat quality, so increasing polyunsaturated fatty acids, for example. Quite often, you know, if children are sort of susceptible to things like gluten intolerance and casein intolerance, we need to maybe look at things like dairy, wheat, gluten, stripping that out of the diet. But the sort of focus today has really kind of been talking about sort of the importance of gut flora and how important it is to sort of restore normal gut flora and omega-3 levels as well. And then there's sort of the importance of sort of treating nutritional deficiencies through nutritional supplementation. So generally kind of omega-3 supplementation is widely used in kids with ADHD and with sort of great success as well. But there are other aspects as well, because it's, from a sort of nutritional standpoint, addressing one nutrient deficiency on its own is not going to sort of be all and end all of a sort of intervention. Quite often there are other nutrients that need to be addressed, factors such as sort of zinc, iron, B6 and magnesium, all sort of associated with low levels in kids with ADHD. And these are all essential cofactors for the production of sort of neurotransmitters and so on that play a role in the sort of symptoms of ADHD as well. So alongside our sort of gut flora, alongside our keeping our cell membranes nicely intact, we also have to make sure that we support a nice healthy methylation cycle, because this is absolutely vital for the production of things like neurotransmitters, cysteine and glutathione, which are really important for sort of detoxification processes. Kids, again, leaky gut syndrome, you get a huge amount of sort of toxin buildup. We really need to sort of make sure that sort of liver function and sort of glutathione antioxidants are kept sort of like nicely sort of topped up to sort of help detoxify and keep everything sort of running nicely. So just to sort of highlight again, so we've got all of our neurotransmitters and sort of cofactors that are involved in sort of neurotransmitter release and uptake. And so this is a slide that I've sort of put together really to sort of highlight the importance of keeping a nice healthy methylation cycle ticking over nicely. So we have sort of methionine, which is our amino acid from diet. We have SAMI, which is our universal methyl donor, involved in neurotransmitters and all these other nice healthy things that keep everything sort of ticking over nicely. Processes, if you don't have enough, are things like neurotransmitter function, fatty acid metabolism, cellular energy, and so on. If we get a buildup of homocysteine, that can then impact on transsulfuration pathways. We get a low impact on sort of glutathione and over into sort of detoxification, production of bile acids, and so on. Our little neurotransmitters that are involved, sorry, not neurotransmitters, vitamins and minerals, sorry. Magnesium, vitamin B6 and zinc are vital for keeping a nice healthy methylation cycle going, and for the production of things like glutathione, which are involved in sort of detoxification. And then sort of finally, what happens, the things that can happen if we don't keep our methylation cycle and one carbon nicely sort of happily ticking over. So we get disrupted gene expression, decreased neurotransmitter function. We get this impacts heavily on things like cysteine and glutathione production. So again, that can then impact on gut function. We get villi flattening and loose function. All these different sort of factors that can sort of exacerbate the symptoms that are associated. And just a slide really to sort of highlight the some of the studies that have looked specifically at cofactors such as zinc and magnesium and B6, assessing sort of deficiency in children with ADHD, and then sort of clinical outcomes when looking at sort of restoring levels. So when it comes to sort of looking primarily at omega-3 intervention, we're finding that a lot of our practitioners are sort of speaking to us about fatty acid testing and sort of talking earlier about the importance of personalized nutrition sort of comes into play here. We kind of generally sort of recommend pure EPA or pure EPA and GLA as a sort of management intervention, fatty acid intervention when it comes to sort of treating ADHD. But it may be worth, if you're specifically treating kids with ADHD, to maybe get their levels checked out and make sure that their DHA levels are actually at a sort of satisfactory level as well. The Optio 3 is convenient, it's relatively non-invasive, so it's a small sort of pinprick test, so it's not sort of too discomforting for the child. And then the protocol itself really sort of focuses on restoring omega-3 index and restoring nice healthy AA to EPA ratio. Our recommendations when it comes to our sort of fish oils are, we kind of focus, as I've said, on sort of EPA and GLA. This is our sort of most successful product when it comes to managing ADHD. This is the product that was used in the double-blind placebo-controlled trial that I spoke about earlier. And we have great success with this product. We have many ADHD specialists who recommend Vajipa with great success. If, however, you do find that some clients may require some DHA top-up, then we have a product called Pharmaca Maintain. 3 capsules contains 250 milligrams of DHA alongside 750 EPA and 60 milligrams of GLA. So this is a good product itself as well for sort of topping up omega-3 index and keeping cell membranes nicely sort of topped up with EPA and DHA. We then have our product Neurobalance, which is our magnesium, zinc and vitamin B6 product that was formulated as a sort of add-on product for Vajipa in managing ADHD, and again we've had great success with this product as well. Again, with all of our products, we kind of go for the most bioavailable, most effective ingredients. So we use magnesium citrate, soluble bioavailable, then other forms of magnesium, especially magnesium oxide, which is found in many of the sort of cheaper supplements. We use pyridoxal 5-phosphate. A lot of kids with ADHD find it very difficult to sort of convert the standard B6 through to pyridoxal 5-phosphate. So delivering body-ready form is really important. And then we split our dosages, and we keep our tablets nice and easy to swallow for children as well. And because they're nice and small, we can optimize it to age and size. So our dosing guide for sort of adults and children aged 12 and over for Vajipa is 6 to 8 capsules daily, with a sort of side portion of Neurobalance at 2 times 3 tablets daily, so 6 tablets daily. And then 8 to 12 we go for 3 to 4 capsules of Vajipa and 2 times 2, so that's 4 tablets of Neurobalance, and then children 4 to 8, 3 to 4 capsules of Vajipa and 2 tablets daily of Neurobalance. Okay, so for children who are under the age of 4, if there are sort of behavioural issues, generally children don't get diagnosed with ADHD before the age of 4, but if there are any sort of developmental or sort of behavioural issues, then we do have a chewable product as well. There's absolutely nothing wrong with taking Vajipa when you're under the age of 4, but it's just sort of worth knowing that because they're kind of relatively small, they can sort of pose a choking hazard. So we have a lot of parents who actually kind of open the capsules up and add it to yogurts and things like that for sort of ease. That's quite successful as well. For younger children, children under the age of 4, yes, you can half it if they're happy to sort of swallow the capsules. Our chewable product, obviously, because we've had to sort of add sort of extra ingredients in there to make it palatable and chewy, you lose a little bit of the active. So 1 Vajipa capsule is the equivalent of 2 Vajipa chewables. Okay, Laura, thank you for attending. Okay, so that's okay, so that's the end of today's presentation. I'll just finish up with a lovely picture of myself and my colleague Sophie. Sophie's the Nutrition Education Manager. And if you need any education materials, please do feel free to contact her. Any technical inquiries, please contact myself. I believe that our next webinar will be sometime in April. and I will be giving an overview of fatty acid testing. So I'll do a sort of comparison. I'm going to be doing a comparison of different laboratories, sort of highlight the benefits of sort of using our Optio3 biomarker test, and why it is important really to sort of incorporate testing into your practice, and some of the factors that sort of influence fatty acid levels, highlighting the importance of testing itself, and then a sort of overview of how to interpret the results as well. So hopefully that should all be quite interesting for you. Thank you very much. Thank you for your kind words. Hi, Celia. No, there are no issues related to epilepsy and EPA. EPA is actually beneficial, reduces seizure frequency and numbers, I believe. Super. Thank you very much, everybody, and I'll let you get back to your working environments, I guess, and see you all again soon. Yes, we give attendance. Yes, we do. We give attendance certificates for the webinar. If you want to just contact Sophie, actually, on saying that, I believe that we send them out to everybody who attended. So if you don't get your CPD points, then do feel free to contact us and we'll get them out to you. Okay, thank you very much, everybody. Bye-bye.